Hello everyone, and thank you for joining today's lecture. Whether you're a patient, a caregiver, a nurse, doctor, researcher, or student, this session is designed to shed light on the internal changes that occur long after a spinal cord injury. While we often think of spinal cord injury as primarily affecting movement and sensation, there's a complex cascade of internal changes that can show up in blood tests and affect overall health. Today, we'll explore how the body's immune system, hormones, and metabolism interact in the setting of chronic spinal cord injury, and discuss what abnormal lab results mean and how targeted treatments may help. Under normal circumstances, our nervous system talks with other parts of our body, including our immune system and our hormone-producing glands, to keep everything in balance. Think of it as a well-organized team, where everyone communicates clearly. In spinal cord injury, however, this communication is disrupted. Two key pathways are affected. 1. The autonomic sympathetic nervous system. Normally, this system helps control how our body responds to stress and injury. After spinal cord injury, the loss of nerve signals to organs like the spleen, lymph nodes, and bone marrow can impair how our immune cells move around and produce important signaling molecules called cytokines. 2. The hypothalamic pituitary adrenal (HPA) axis. This axis regulates our body's stress response by controlling hormones like cortisol. After a spinal cord injury, there can be an initial surge of cortisol, followed by a drop that leaves the body unable to properly regulate inflammation. Together, these disruptions lead to a condition of chronic, low-grade inflammation. Blood tests often reveal elevated levels of markers like C-reactive protein and cytokines, such as interleukin-6 and tumor necrosis factor alpha. While in the general population, these markers might suggest an infection or other acute issue, in chronic spinal cord injury, they often reflect an ongoing internal imbalance. When cytokines like interleukin-6 and tumor necrosis factor alpha are persistently elevated, they don't just stir up inflammation. They also change how our body processes certain chemicals. First, tryptophan and mood. Tryptophan is an amino acid we normally use to make serotonin, the feel-good neurotransmitter. In chronic spinal cord injury, inflammatory signals can divert tryptophan away from serotonin production toward other pathways, which can contribute to depression. Second, pain and prostaglandins. The same inflammatory signals can trigger the production of prostaglandin E2, a substance that contributes to neuropathic pain, making pain management a common challenge for spinal cord injury patients. Many spinal cord injury patients develop a type of anemia that is not due to blood loss, but to chronic inflammation. Here's how it happens in simpler terms. First, iron sequestration. Inflammation raises levels of a hormone called hepcidin, which tells your body to hold on to iron rather than absorb or recycle it. Even if iron levels in the blood appear normal, less iron is available for making red blood cells. Second, bone marrow resistance. Inflammatory cytokines can also make the bone marrow less responsive to erythropoietin, a hormone that normally encourages red blood cell production. Third, fluid shifts. Fluctuations in blood volume, sometimes from episodes of autonomic dysreflexia, can make red blood cell counts seem lower than they actually are. Spinal cord injury can also lead to a state where the blood is more prone to clotting. First, endothelial activation. Loss of nerve signals can change the way blood vessel linings work, leading them to release factors that promote clotting. Second, platelet hyperreactivity. Increased stress hormones can make platelets, the cell fragments that help with clotting, more sticky. Third, fibrinolytic shutdown. There's also a reduction in the body's ability to break down clots, which is why markers like D-dimer, a breakdown product of clots, are elevated. For men with spinal cord injury, low testosterone or hypergonadism is common. Several factors contribute to this. Inflammation's direct effect. High levels of cytokines like TNF-A can directly inhibit testosterone production. Nerve disconnection. The loss of nerve signals to the testes further reduces hormone production. Changes in fat tissue. Increased fat, particularly around the abdomen, can convert testosterone into estrogen, worsening the hormonal imbalance. Low testosterone can contribute to muscle loss, increased fat, and even worsen inflammation and insulin resistance. SCI also disrupts the balance of calcium and bone remodeling, leading to a paradox where patients can have both high blood calcium levels and weak brittle bones or osteoporosis. During the acute phase, which is the first 0 to 24 months, rapid bone loss occurs because the bones aren't being used due to immobilization, and the loss of nerve signals further encourages bone breakdown. The calcium released into the blood suppresses the parathyroid hormone, which normally helps rebuild bone. In the chronic phase, after 24 months, prolonged low PTH levels impair the bone's ability to repair and remodel, setting up a cycle that eventually results in osteoporosis, despite high calcium levels in the blood. Chronic spinal cord injury patients often develop a unique form of metabolic syndrome, a cluster of conditions that increase the risk for diabetes and heart disease. Fat accumulation. Without regular movement, fat tissue can increase, especially in the abdominal area. Insulin resistance. Inflammatory cytokines interfere with the normal action of insulin, making it harder for the body to manage blood sugar levels. Dyslipidemia, hormonal imbalances, such as low testosterone, can alter how the liver processes fats, leading to higher levels of unhealthy lipids. Together, these changes can create a cycle that further worsens overall health. To summarize, chronic spinal cord injury sets off a chain reaction: neural immune endocrine disruption. When the spinal cord is injured, the loss of normal nerve signals disrupts the balance between the immune system, hormone production, and even how cells use energy. Mechanotransduction. Failure. Our bodies rely on movement and weight-bearing to maintain healthy bones, muscles, and blood vessels. Without these signals, the tissues begin to deteriorate. Accelerated cellular aging. Chronic inflammation and oxidative stress can speed up the aging process in cells throughout the body. Understanding these interactions helps explain why blood tests in spinal cord injury patients often show patterns that differ from those in the general population. These aren't isolated problems, but interconnected signs of a system-wide change. For patients, caregivers, and healthcare providers, it's important to recognize that elevated CRP, Illinois 6, and TNF-A levels may not indicate a new infection, but rather a chronic inflammatory state. Abnormal blood counts or high D-dimer levels need careful interpretation in the context of spinal cord injury. Low testosterone in men and disruptions in calcium and PTH levels can signal risks for muscle loss and bone weakness. Changes in blood sugar and lipid profiles should prompt lifestyle and possibly pharmacologic interventions. These insights empower spinal cord injury patients and their caregivers to communicate effectively with all healthcare providers, even those not specialized in spinal cord injury, about what the lab results really mean. Given these complex changes, emerging treatments are focusing on rebalancing the disrupted systems. Let's look at some of the pharmacological interventions. First, we have minocycline. This antibiotic, in addition to its antimicrobial properties, helps reduce inflammation by affecting immune cells in the spinal cord. Next, CSF1R inhibitors. These agents target specific immune cells, reducing harmful inflammation while preserving beneficial cells. And finally, Illinois 6 receptor antagonists, such as tocilizumab. By blocking IL-6, these drugs help lower hepcidin levels, improving anemia, and reduce systemic inflammation. Hormonal and endocrine restoration plays a crucial role in managing spinal cord injury. For instance, testosterone replacement therapy can help restore normal testosterone levels, counter muscle loss, improve bone density, and reduce inflammation. Another approach is low-dose hydrocortisone, which can help normalize cortisol rhythms in patients with HPA axis disruption without causing excessive immunosuppression. Moving on to neuromodulation techniques, vagus nerve stimulation, or VNS, can reduce systemic inflammation and even improve respiratory function by stimulating the vagus nerve. Additionally, transcranial magnetic stimulation, or TMS, may help modulate brain and spinal cord activity, reducing pain and promoting healthier immune responses. Metabolic and lifestyle interventions are also essential. For example, omega-3 fatty acid supplementation can shift immune cell metabolism towards a less inflammatory state. Time-restricted feeding, or limiting the eating window, can improve metabolic markers and reduce inflammation. Emerging biologic therapies are showing promise as well. Mesenchymal stem cell infusion may release factors that reduce inflammation and promote tissue repair. CSPG targeting enzymes help degrade inhibitory molecules in scar tissue, potentially promoting nerve regrowth and modulating the immune environment. While these strategies are promising, Balancing the need for repair with the risk of suppressing necessary immune functions is challenging. Future research is focusing on timing treatments appropriately, such as using strong anti-inflammatory agents in the acute phase, followed by regenerative therapies later. Restoring neural communication is another focus, with new approaches aiming to re-establish the lost connections between the nervous system and other organs. Lastly, targeted drug delivery techniques like nanoparticle carriers or implantable hydrogels may allow for precise control over where and when drugs act. In summary, spinal cord injury is far more than a loss of movement or sensation. It triggers a complex, system-wide response affecting the immune system, hormones, blood health, and metabolism. Recognizing these changes can help patients, families, and healthcare providers better interpret abnormal blood tests and tailor treatment strategies accordingly. Emerging therapies offer hope by targeting these underlying pathways, aiming to rebalance the body's internal environment and improve quality of life. Thank you for your attention. I hope this lecture has provided a clearer picture of the hidden internal changes following SCI and empowered you with the knowledge to navigate these challenges. If you have any questions, please feel free to ask.